Okay, so I'll start us off, guys. Thank you for joining us tonight with Coach Rima. I'm Deborah. I'm with Rima and Mal, who do not need any introduction. Uh, we wanted to talk about and educate the understanding how to strengthen the female pelvic floor because there's a lot of misconceptions. A lot of people think it's just about doing Kegels. And as
Mhm.
Rima had mentioned, that people associate weak pelvic floor with having had children. Uh, you can have a weak or an overly tight pelvic floor. And while I have said that in mixed company where men snicker, like, ooh, that would be great, it's not what you think about having, like, it's not having like a tight vagina, it's having a tight pelvic floor, which does not know how to relax and be flexible. And when you don't understand the difference between weak and overly tight, then it can actually mess up your fitness journey. And then as you get older and you become closer to perimenopause and then postmenopause, you're having potentially a lot of problems. So, um, I'll get started. You know what, guys? I just want you to know that I jumped on here last night and did a run through. I actually did a run through with this and it worked. So why is it now? Okay, good. All right. So what is it and why it matters? Um, we're going to talk about that, how it changes through your different cycles of life from pre-pregnancy, if you are ever going to have children or you've had children, and how it definitely changes through hormonal changes. And then we'll end with common problems, mistakes that are made, and then how to strengthen your pelvic floor. So basically what it is a group of muscles that go, they're like, it's like a hammock. So it goes from, I like to give the visual your underwear, the crotch of your underwear, all the way up to underneath your rib cage, where your diaphragm is. And so posture and breathing, if you have poor posture, you don't know how to do proper breathing exercises, they all contribute to having a very weak pelvic floor. And posture, again, not wanting to take it back to pregnancy or postpartum, but nursing, sitting at a computer like this all day. I have a client that's never had kids, but she's a dental hygienist. So all day she's like this. And she kept saying, like, shoulder issues. Yeah, it's not just your shoulder, it's not just the rib flare that you have, it's also a very weak pelvic floor. And then people think that weak pelvic floor just means that you pee your pants, but that's not the case. It your your pelvic floor is also responsible for the strength that goes from your spine, from your hips, all the way up your spine. It's to you when it's functioning properly with every twist, every breath, every bend, basically everything you do will either affect your pelvic floor or your pelvic floor will affect what you're doing, meaning that there's such a strong interplay between having this part of your body, actually the strongest part, it should be very strong because it'll affect everything else that you do with respect to exercise in your daily life. And then taking it into your organs, yes, it controls your bladder, your uterus, and your rectum. And that's often where problems will show up first and loudly. People will ignore any kind of posture issues or breathing issues or rib flares, but they will not. Like, if your if your uterus is coming out of your vagina, well then, you have a prolapse. That is a severe case of a weak pelvic floor. Hopefully, after tonight, you'll have a better understanding. And if you're having some issues, talk to your coach about strengthening. But when things are starting to fall out of you, then your coach kind of needs to know that, because the way that you lift weights really needs to be modified, or at least in the way that you breathe. um, your pelvic floor continence, which is, holding your bladder, your posture, and it supports sexual function and stability. Did Mal or Rima, did you want to jump in and say anything?
No, you're doing great.
Okay. Okay, so these are the layers of the muscles. You have your primary muscles, and as you can see, just by looking at the names, like I'm not going to even try to attempt these names because I'm not in anatomy class anymore. The pubo, ilio, and then coccyges, that is the deep muscles, and that's the ones where I say it's down in your underwear. So that's where we always think, oh, that's my pelvic floor. But it extends upwards to your transverse abdominis. So, ladies, if you skip doing vacuums or you don't like to do vacuums, you have to learn then how to engage your TA, your transverse abdominis, which is the ab muscles that run on around your body, around your hips. It would be like when I used to teach Pilates, I would tell everybody, pretend I just put a belt around your hips. Okay, you're wearing a hipster belt. I've got you on hole 3. Now I need you to go to hole 5. So I'm going to like crank that. You need to suck in tight, but you're not holding your breath. And
Mhm.
now I've got that belt down at hole 5, which is too tighter. And I want you to keep it there now while we move your legs. So that's your transverse abdominis is really important to strengthen. We'll strengthen obliques because they give us those nice ab lines. Your diaphragm needs to be strengthened through breathing. Your multifidus group of muscles with your quadrilimborum or on your back. You can't see them, but these are the group of muscles that run up and down your spine. And then you have your glutes, weak glutes, very weak pelvic floor. So if your glutes aren't firing, it's not just about having a nice juicy booty, it's about having it functional and making sure that, I make jokes about my age, but I'm going to tell you something. I have friends that are my age, 60. I have friends that are 65. And the way they walk upstairs, because if they don't work out, leaning forward because the glutes aren't. And then, yes, they have all those other problems too. And then your adductors, your inner thighs, they need to be kept strong. But
So
I'm not
everything
even worried about that because you have coaches. So your coaches are making.
yeah, like we program in a very specific way for our clients, in that, we don't always articulate like why you're doing certain things, but there is a science behind it. And sometimes, I notice with a lot of people, I had a conversation with a family member 2 days ago. And, they don't like to do certain things because they find it to be a waste of time, or like, yeah, but, I really want to grow my delts. So like, why am I doing that? And I'm like, well, everything is interconnected. And if you're not, even though you can't see these muscles, or you can't see, what's going on inside, it doesn't mean that you shouldn't be working it. Like there's a reason why you need to be working it. And if you continue doing what you're doing and avoid this area, you're going to fall apart. And when you do, it's going to be really hard to come back from that. You're going to have a severe injury, like something is going to happen, you're not going to feel good. And then it's really difficult to come back from that, instead of just strengthening your body as a whole and doing what you need to do from the beginning, and then avoiding the complication down the road.
Yeah. So, and I wanted to just put this picture in just to give you the visual of when I called it the hammock, because it is a structure. It does look like a hammock because the way it goes through your pubic bones,
Yeah.
and it's stretching from your pubic bone at the front to your tailbone at the back. So it's, like when I, again, I will say, the crotch of your underwear, because that, when I'm teaching somebody how to strengthen it and do a proper tightening of this area, it's no good to just say tighten, or it's more trying to give them the visual that, okay, if you're thinking about the crotch of your underwear, now it's going to be an elevator. It's on an elevator, that crotch, and it's rising up and you're pulling up. It's not just clenching. So if you look at this and you think about it, with your if your pelvic floor is weak, yes, it's going to affect your bladder. And yes, it's going to definitely affect your uterus. And it doesn't have anything to do with having had children. Your uterus will start to fall and it will start to come out of you. If you are somebody that likes to lift heavy, meaning you like to get on that leg press and load up the weights. I am so proud of myself that at my age and having had two kids, that I can load up to 4 plates on each side and do leg press without peeing my pants.
Mhm.
And I mean, like, you might be like, oh, well, good for you, Deborah, but I've had women pee themselves doing lateral raises, because as soon as they start to engage, there's nothing there to hold it. So if you want to have longevity in taking care of your body with lifting weights, you really want to think about this, so that you know, you're not peeing your pants. I,
I experienced that. I'm embarrassed to say, but I experienced that after I had my daughter, and I would hear of like women say these things before, and I was like, yeah, yeah, whatever. And I remember like I went to this workout class, and I'm like, I just need to shed this baby weight, and she was like a few months old. Um, and I like literally peed, and I was like, oh my God. And I couldn't control it. And it happened a few times, and I was so embarrassed. I was like, oh my God, I need to fix this issue. Like, I'm not going to live like this. I refuse. So I did a deep dive into restoring my pelvic floor because I honestly did not want to be peeing myself all the time. But yeah.
I think what's good too is that with your pelvic floor and it being weak, it gets strong very, very quickly. Like it's something that can change very quick. I had a client who, like an older client who had a prolapse and like very, very weak core. And we, aside from doing breath work, I think a lot of people incorporate bird dogs in their programming, or what's that other one when you're lying on your back? I always
oh, on your back, a dead bug.
Yeah, I can never remember that name. Yeah. So, again, those are certain exercises that, like Tarima's point, where some clients may have that feedback where they're like, why am I doing this? Like, I'm not, I don't see a pump in my body, but those are really, really good exercises that just incorporating that with her for a few months, she was like it improved dramatically when she had a follow up with her doctor as well. So it wasn't that we had to like necessarily lift heavy weights or like do specific exercises with weight. It was more just focusing on the breathing and certain exercises with your body control. So it's a good thing that like, we don't think about these things now, especially if, for some women that are not in their later stages of life. But then, to Deb's point, just you don't want to have to deal with it where it's now you're starting to fix it in your 60s.
Yeah, it's true. And I've kind of talked enough about urinary fecal leakage, all of that stuff. We get the picture. We understand that that can happen. So women that have had children that have diastasis, which is a separation of the abdominal wall, you have about 18 months after you give birth to, if depending on the severity and the grade of the diastasis, to actually have it meld back. I didn't have that. I was very lucky. How do you know if you have it? If it's been more than 18 months, lie on your back, take your fingers, three, go up about 2 inches above your belly button, do a quarter crunch. And if your fingers will go in, you will feel a separation. If you're like, is it separating? I don't know. What do you think? then you probably don't have it, or get your coach to test you if you come into HQ. But if your fingers, 3, 2, can go right in and you can feel that separation, it doesn't mean that you can't strengthen back your core muscles. It just means that you can't be doing crunches anymore, because that's just going to exacerbate that splitting. But if you also need to strengthen though your abdominals, because if you don't, then your pelvic floor takes on the extra work of doing what your abdominals should be doing. So women that just kind of ignore it and go, oh, I have DR, I have diastasis recti, I can't do crunches.
Mhm.
Okay, but you still need to strengthen your abs. So to Mal's point, bird dog, dead bug, yeah, it might be boring, but as you get stronger, I'll tell you, you can be sweating buckets doing bird dog and dead bug in
Mhm.
very challenging ways. You don't have to do them how we start you. We can progress you to be doing them balancing, without your knees on the floor, lying on your back doing dead bug, where you are doing both arms and both legs. And doing, but you have to get strong to be able to do that. You can't go into a hollow hold if you have DR and you haven't spent the time to strengthen. Now, sexual pain or reduced sensation, out of my scope of practice, ladies. So I'm not talking about that. It's just know that this can happen. Does anybody have any questions? Okay. So, oh, why did that go? So some of the contributing factors that we didn't talk about is constipation and chronic coughing. So people who do not eat enough fiber, that when your coach says, hey, like you hit your macros, but I noticed your fiber this week was only 12 grams. Like, 5 out of the 7 days, and you barely got over 20 on those other 2 days. This is a contributing factor. It not one time, and maybe not 100 times, but we don't know what the tolerance is for your body. Women that do suffer from chronic constipation, um, apparently it's not normal to only even go once a day. Like,
Yeah.
we're supposed to be going a few times a day. We've
Yes.
just normalized going once a day. And then there's those women that will say, I really only ever go when I'm getting my period, because of all the hormonal changes, which helps them, be able to regulate better. But if you do have constipation, then you really want to start taking more of a look at your diet and keeping your hydration up, because that will also contribute to a weak pelvic floor. So it, again, has nothing to do with childbirth or anything. And then again, the sedentary lifestyle or obesity, but you're with us, so we're all taking care of that. Okay, moving on to your pelvic floor through your life stages. Before you're pregnant, or not even planning to be pregnant, for women that just have never had children or do not plan on having it, you still need to think about this, because you want your pelvic floor to be flexible, meaning that it should be able to contract and support your body as well as relax properly. Because if it becomes too tight, you're going to have issues with bladder control, believe it or not, and all the other problems I was talking about. In pregnancy, the hormonal shifts and load management, I think it's pretty self-explanatory that you're now carrying potentially at least another 25 to 30 pounds. And that's for women that stay within the recommended guidelines of gaining weight during pregnancy. Some women will gain up to 40 because maybe they were, underweight to begin with. And then generally anything above 40 is just maternal fat. So the more maternal fat that your body is gaining, that's not only putting more pressure on your pelvic floor, but it's also changing the way your body reacts hormonally. Postpartum rehab and reconnection, meaning how to reconnect to that pelvic floor. I don't know about you, Rima, but I remember, and I'm sorry if this is too graphic, I was 25 when I had Carly, and I remember going into the bathroom and being so afraid to pee because it was stinging. And the nurse was saying, just pour this water down over you. It'll dilute the urine. And I looked down and I screamed because everything was so loose. Like it looked like a hound dog. Like I
Yeah.
was like, ah, like what happened? And she was like, you're gonna need to like practice holding. I was like, holding my urine? Stop. I was bawling. And I remember my mother, who's always so sweet, going, oh, for God's sakes, it's all gonna come back. Don't worry. You just had a baby 24 hours ago. But like nobody told me about a pelvic floor. I was not a
Yeah.
Pilates instructor then.
I remember like sitting on the toilet and I just felt like my vagina was big. Like I felt like somebody could honestly just like look up there and see all like it. Oh,
Yeah, like
Oh
so
my
when we talk
God.
about the rehab and reconnection, it's reconnecting to that part of your body again because
yeah.
everything is so stretched out. Like it's literally like, you know, and get it. I mean, it's gonna go back to where it goes back, but it's like if you look at it this way, your pelvic floor after postpartum is very much like bubblegum. You chew it, and then take the bubble gum out and stretch it out, and then put it on the table and leave it alone. Okay, it's going to contract and come back a bit, but it's
Mhm.
never going to go back to that nice little piece it was without
Right.
help. You're
Yeah.
going to have to reshape it. You have to do the same thing with your pelvic floor. And
Mhm.
the good news, like I think it was Rima that said this, it's never too late. It is
Yes.
absolutely
Yeah.
never too late. And then the peri and post menopause, you want to maintain tone so that you're not peeing your pants. Like Lexi's really big on the rebounder. And I
Mhm.
told Lexi, I said, oh, I got to go pee 3 times before I can get on that damn thing. I can leg press a lot, but I start jumping and it's like,
Yeah. Same.
yeah, rebounder. And like, I'm petrified if we ever do a team thing where we're going to go do a trampoline because I'm like, oh my God, I don't know. So that
You
is
wear your
not,
diaper.
yeah, I will because as your estrogen goes down,
Yeah.
it affects that area. Like your urine control, your um that whole area is affected by the loss of estrogen. And even
Yeah.
women that are taking HRT, it helps, but it's not the same as so again, if you haven't had kids or you have or whatever and you're not thinking about it, one day, ladies, you will get to those ages and you will have to give it some thought then. So why not start thinking about it now? And
Mhm.
even circulation, your circulation and elasticity of the area, you want to make sure that you can still contract your pelvic floor and know how to relax it. Let me just see here. Did I miss anything? Oh yeah, I talked about the increased risk of prolapse, and there's different stages of prolapse.
Mhm.
So if you're wondering, do I have a prolapse or don't I? If it's really bad, you'll know because you'll
Yeah.
feel a bulging and you can
Mhm.
actually see a bulging.
I think you can also feel it, like touch it with your hand, depending
Yeah, oh
on how
yeah,
severe it is. Yeah.
yeah. And I've had clients that have had surgery to fix
Mhm.
a prolapse, and they cannot do they can't do heavy leg work. They just can't because it's it's so traumatizing to them to have to go through that again that they would rather just do all the pelvic floor work but then not have to worry about strengthening the other parts of their body because they're just too worried. But like Rima said, strength training and estrogen support really, really help women in the peri and postmenopause stages. So how do you strengthen? Well, it goes beyond Kegels. Kegels aren't enough because that constant tension of doing a Kegel can it can actually lead to tightness and then pain. And what I mean by pain is that you will, hi Lexi. Uh, the pain is generally in your lower back because the pulling down will pull on your organs or muscles, and your actual pelvis comes in the wrong position. So you have to actually learn how to breathe with intention, proper inhaling to relax, and then exhale. As you're exhaling, learn how to do the Kegel, how to do the tightening, and that's that lift, right? What I was talking about doing the elevator, the
Mhm.
underwear elevator move.
I like to say, like, pretend you're pulling up your muscles up and in, like you're trying to fit into a pair of jeans that are like, they fit you, but you have to get
Yeah.
that button in. So you're kind of lifting up and you're making sure you're exhaling at the same time. I think the biggest thing is just being able to make the connection. And it's actually kind of therapeutic. It reminds me a little bit of meditation when you're able to connect your breathing, but then you're able to find your pelvic floor, and you'll notice it's very similar to when you brace your core in certain movements with training, right? So a lot of people that aren't able to do that, they think that they have to hold their breath. They're not actually engaging their pelvic floor to be able to engage that intrinsic muscle as well.
So if you don't know how to do the breath work, ask your coach. Because just really briefly, when you're inhaling, you need to make sure that your diaphragm is dropping and that your ribs are expanding and that the pelvic floor relaxes and lengthens. And then when you exhale, you're thinking about the diaphragm rising, just like what Mal was saying. Um, One other little visual tip that I give my clients for when they're doing the strengthening of the pelvic floor is start with thinking that you have a marble. So you know how the weight of a marble is? You have to think about that. It's not very heavy, but that you've put the marble into your vagina and now you're going to hold it. So you don't have to clench, but you're just like, oh, I've got this marble and I don't want the marble to drop out onto the floor. And just that little bit of holding there, but learning how to breathe through it and then, release and then breathe, tighten and release. So again, if this is something that you need work on, I'm giving a very general overview. Talk to your coach about that. Um, Yeah, I talked about that. Okay, good. So here's all the exercises that Mal already talked about.
I'm a
With
little
pelvic
ahead.
tilts and bridges, make sure you're doing your pelvic tilt and bridge properly. Was there something in the chat? Did somebody ask a question? Could you look for me?
There are those marbles for sale for that bullets. LOL.
Is that from Jamie?
Marlene.
Marlene. Oh, okay. Yes, there are. You can actually there's actually things that you can buy.
Mhm.
And if you have ever worked with a pelvic floor therapist, they often will have you because you need to do homework.
Mhm.
But and again, ladies, do not go out and buy marbles because Coach Deborah said to. Like, no, 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 no. I'm trying to give you the visual. But with your pelvic tilts and bridging, if you're not starting with neutral spine and you don't know what neutral spine is and how to go into a proper pelvic tilt, you're not doing any good for yourself. And a lot
Mhm.
of women will say to me, oh, I get such bad sore lower back. If your lower back is hurting you while you're doing a pelvic tilt or a bridge, you're doing it wrong.
The same thing with a bird dog and a dead bug. I see people doing these exercises all the time. And like, I've had clients say to me too, like, I just don't find them challenging. And I'm like, well, if you don't find them challenging, it's because you're not doing them correctly. Because if you are engaging your core and your pelvic floor doing these exercises, your abs will literally cramp up like so bad. And you'll be like, oh my God, I'm sore for 3 days. That was the hardest
Yeah.
workout. But if you're doing them, like I see most people at the gym or not at HQ, but commercial gyms are doing them, they're not doing them properly, and so you're not going
Hmm.
to get the most out of it. You're not going to feel it, and it essentially it's useless. It's pointless, right?
Hmm.
So if you're going to do these exercises, you need to do them in a very specific way and with intention. Like you have to think about what you're doing, think about the muscles that you're using. They're slow movements. You're not rushing through them. You're not trying to bang out the reps. Um,
Hmm.
but you can really I did these steady after I had my daughter, and they made a huge difference.
Yeah. When you're doing a bird dog, picture that you have a full glass of water on your back. That water should not jiggle and it
Yeah,
should not fall off your back.
yeah.
So that's how slow and intentional you want to do them. Um, Same with doing like your squats, any kind of squats with an exhale lift cue, meaning that you're not just holding your breath. When you hold your breath when you're lifting, you increase intra-abdominal pressure, and that actually is negative, has a negative reaction on your pelvic floor. So
Hmm.
learn to engage your core properly, not just hold your breath. And that's, it's very common when a new client starts with me and they say, these vacuums, am I holding my breath? Like no, you're
Yeah.
not holding your breath. You're learning how to engage your, your TA,
Hmm.
um, and still be able to breathe.
And
Uh,
your TA is like the deepest part of your core, right?
yeah.
Like it's not just about the abs that you can see visually,
Hmm.
like, oh, I have these ab lines and my obliques, and like your TA is it's the deepest part of your core. So if you're not working that, then the outside is not going to be functioning properly
Hmm.
either.
Hmm.
Yeah, and if you don't know, and get a session with your coach, or if your coach doesn't do it, get a session with one of the coaches at HQ. And what I mean doesn't train at HQ, most of us do, but not all the coaches do, because you want to make sure that when you are doing your lifts, you're not just clenching your glutes or you know, contracting your abs or holding your breath. There's a very big difference between engaging your core properly and then just tightening or clenching your glutes.
Mhm.
Um, because again, even though I keep talking about tightening, your pelvic floor needs to be like a trampoline, actually. It needs to be springy. It needs to be able to contract and retract. So, and move as you do, because like I said at the very beginning of this little presentation, it's responsible for everything from breath to twisting to lifting to holding your posture to all your internal organs, that you're using when you're going to the washroom,
Yeah.
sneezing.
Hmm.
Anything else that I forgot here? Common mistakes?
Nope. No, I think you covered it.
Okay. So how to keep yourself really healthy with this. The hydration and fiber. Hydration goes a long way because it's going to also help with your fiber. Posture and spinal alignment. Again, any kind of rib flaring or a pelvis that tilts forward or you walk around with it tucked under, either is not good. You never want to live in the extremes. How to properly strength train for your glutes and adductors, and then limiting bladder irritants. What are bladder irritants? Things that make you go pee a lot. So, like too much caffeine or even alcohol. I'm trying to think if there's something else.
Hmm.
I can't think of any, like another irritant. Regular pelvic physio, that I put on, even though we can help you, but some people have it. Like I had a client, I still have a client, she's in the United States. I was going to use her as a case study tonight, but then I decided not to. She was in very bad condition when she started with me, and her son was over a year. She'd had to have a surgery, a metal mesh put in. She had hernias. Her pelvic floor was gone. And
Oh,
she had to get cleared by a pelvic physiotherapist before she could even start to work with me for exercise. We just started with her nutrition first because she still hadn't lost her 40 pounds of baby weight. Once the physio, I sent all my programs to this pelvic floor physiotherapist, and the pelvic, they were like, yep, do this, do this, do this. And then finally she left her and then has just stayed with me. But so if yours is really, really bad, or you do have a prolapse, you probably should have a medical, a medical doctor or a pelvic physiotherapist have a look, and then working with your breath work and relaxation. So just to go back to the pelvic physio, I'm not saying go to 1 to 100 already. It's just if you've got really bad issues, it wouldn't be bad, because then it actually helps your coach out, because the coach will be as long as we know where we can go, we can program, you know.
for sure. Mhm. Huh.
And that's the key takeaways for tonight. If anybody has any questions.
Yeah. Any questions, ladies? Has anyone experienced pelvic floor, any issues that after listening to this that we're like, oh, I might have, that might be an issue of mine, or recovered? Any stories to share? Any peeing on jumping on a trampoline as well?
Nobody wants to admit to that.
It's a safe space, ladies.
Or sneezing. Yeah, and don't hold your pee for a long time. Like the other day, we did a clinic, and a form clinic, and I got talking, and I was like, "Oh, I have to go pee." Oh, but we're starting now. So then 90 minutes goes by, and I'm thinking, "Oh, I still got to go pee. Like I've got to go pee." And then we do a group photo. And then I was like, I still have to go. And then both washrooms are being used, because why not? There's 20 women in there. So of course the two washrooms are going to be used because there's 20 women. So I was like, I can make it home. It's only 25 minutes. There was traffic on the 401. And I was just like, oh, pelvic floor, please do not let me down. And then I started to sneeze. Well,
Oh,
you know what it's like when you're wearing light gray leggings. Yeah, I was so grateful to have stolen a Good Life towel in my car because I wrapped it around my waist as I went into my condo building. Yeah, I have no shame. No shame. Sorry if I'm your coach. And you're like, oh my God, that's my coach. All I just kept thinking was, Deborah, when are you going to learn? Like, it's not that I have a weak pelvic floor. I pushed it for 4 hours. You don't
yeah.
push it for four
Oh,
hours.
yeah. That honestly, the worst thing you can do is like hold your pee or be like, I'll pee when I get there. Like if you have the opportunity to do it, then do it now, because I've been in situations like that too where I'm like stuck in traffic, or you never know what's going to happen. And then your 20-minute drive ends up being 2 hours later and you're dying. Like, no, thank you.
No,
So
thank you.
I don't
No.
do that.
So somebody just put a comment that said their pelvic physiotherapist said that they have an overly tight pelvic floor, and they didn't realize that they could have bladder issues with that as well. So
Mhm.
they're like, thank you. So yeah, if that's the case, then you have to work with your therapist Hopefully they've given you some exercises on how to relax. And you really shouldn't be doing Kegels. If you have an overly tight pelvic floor, you do not want to be doing Kegels.
More breath work.
Yeah, more breath work, way more breath work.
Yep.
Anybody else want to share about their vaginas or their bladders before I This is what I love when the FF coaches aren't around. I can be Deborah.
No.
No? Okay, well, I will stop recording now.
Thanks, ladies, for
Thank you
joining.
so much for joining.